Hernia. I'm pretty sure you must have heard this before. In fact, many of us have heard this phrase floating over in our day-to-day life. But most of us do not know how hernia affects us. What it is in the first place even. Well, buckle up, because in today's video, we are very quickly going to cover everything there is to know about hernia. Welcome back to our channel, everyone. If you are new to our alley, just a gentle request to subscribe to our channel if you are interested in health tips, guidance, and practical wellness hacks for everyday life. On this channel, we try to spread awareness on how we can keep ourselves fit and healthy by employing natural means. We are not against hospitals and medications. It's just we are trying to save you to get to that stage. Nobody wants to be running hospital rounds just because of some unhealthy habit they have been accustomed to following over the years. Today we are diving into a topic that affects millions globally. Hernia. Now hernia is something curable only with a surgery. But why to even have hernia developed in the first place, friend? If only you knew some basic lifestyle habits, you probably would have never developed this disease anyway. That is exactly our mission, to make as many people as possible aware about avoidable habits that they have been used to living with and altering food patterns that could literally change their lives for good. So let's jump right into the main video now. What is a hernia? A hernia occurs when an organ, usually part of the intestine, pushes through a weak spot in the muscle or tissue wall, creating a visible bulge under the skin. It's most commonly found in the abdomen, but can also appear in areas like the groin or even near previous surgical incisions. Why does hernia happen? Hernias usually form due to muscle weakness combined with strain or pressure on the area. Common causes include heavy lifting. Straining or lifting weights incorrectly can stress muscles, making them more vulnerable. Chronic coughing. Frequent forceful coughing, often from smoking or respiratory issues, can weaken muscles over time. Constipation. Excessive straining to pass a stool can also contribute to abdominal hernias. Obesity and pregnancy. Added weight can create extra pressure on weakened muscles, increasing hernia risk. Aging. As we age, our muscles naturally lose some strength, making them prone to tearing. Signs and symptoms of hernia. Hernias often start with a noticeable bulge that might disappear when you are lying down. You may feel discomfort, a sense of heaviness or pain, especially during activities like lifting, bending, or even coughing. In severe cases, hernias can lead to nausea, vomiting, or inability to pass gas, which could indicate an emergency needing immediate attention. Types of hernia. Now let's briefly touch upon various types of hernia. Inguinal hernia is the most common, occurring when part of the intestine pushes through a weak spot in the groin muscles. It often affects men due to natural anatomy. Femoral hernia. It appears in the upper thigh, more frequently in women, and is caused by strain on weakened muscle walls. Umbilical hernia. It occurs near the belly button, usually in infants or adults with excess abdominal pressure. Hiatal hernia. It happens when part of the stomach pushes into the chest cavity through the diaphragm, often causing acid reflux symptoms. Lastly, incisional hernia. This develops at a previous surgical site due to weakness in the healed muscle or tissue. Recognizing these types helps in understanding specific risk factors and appropriate treatments. Prevention and remedies. While surgery is the only way to repair a hernia entirely, there are several remedies and lifestyle changes that can help manage symptoms and prevent worsening. Strengthen core muscles. Regularly engage in exercises that strengthen core muscles. Focus on low-impact exercises like walking, swimming, or yoga to avoid extra pressure on the abdomen. Avoid heavy lifting or learn safe techniques. Use your legs to lift instead of your back, and always avoid lifting weights heavier than you can comfortably handle. High fiber diet. Constipation can put strain on the abdomen, so incorporate fiber-rich foods like fruits, vegetables, and whole grains to support healthy digestion. Healthy weight maintenance. Reducing excess weight decreases abdominal pressure, lowering the chance of hernia development or worsening. Remedies to alleviate discomfort. Try ginger tea, which is anti-inflammatory and can aid digestion, or a small amount of apple cider vinegar diluted in water to support gut health. While lifestyle changes can help manage symptoms, if the hernia becomes painful, changes color, or you experience nausea or vomiting, seek medical attention immediately. So here are some final thoughts on this. Remember, hernia associates itself with weak abdominal muscles, and excessive strain on these muscles can lead to hernia down the line. Be mindful towards activities you are doing that involves tightening of abdominal muscles. For instance, lifting heavy weight puts a strain on your abdominal muscles. Excessive cuffing and forcibly passing stools are another common reasons for putting unnecessary strain on those muscles. So the best measure would be to identify if you have weaker abdominal muscles. You will know this based on how frequently you develop a pain there, and whether knowingly or unknowingly you are putting undue stress on them consistently. Hernias can be managed with awareness, lifestyle adjustments, and simple remedies. Keeping your body healthy through a balanced diet and gentle exercise is the key. So take care of your body and be mindful of any changes. And remember, early intervention can make a huge difference. But remember, once you develop a proper hernia, right now there is no medication to cure it except performing surgical operation. So make sure you watch and re-watch this video again to by heart the points mentioned earlier. Who knows, this could prevent you a future unwanted hospital admission. If you found this information helpful, don't forget to like, subscribe, and share this video with anyone who may benefit from it. Stay fit, stay sharp, and we will see you in the next video.